Hey you guys, so I know I haven't made a video in a minute. I am now in week 10 of the semester, and today was actually my last clinical day. So I would say overall I had a pretty good experience in clinical. I would say by today, and probably the last few days that I've been pretty much functioning, doing a lot more things like the doctor's notes and things like that, which is very important. You know, that's how you get paid, is your documentation and billing and things like that. And then that's how you make sure that you provide adequate care and adequate follow-ups, because you have your great documentation to go back and reference. So the preceptor did have me doing all of those things, and I would just email her my notes, and then she would add it into the actual chart, and she would glance over it and everything and make sure it was okay. So I feel great in that aspect now that I have my whole flow down when it comes to that. I would say for those who have not started, or for those who have started and you're early in your program, when you have an assessment course, because I know all schools will give you some kind of assessment, probably lab, where you either have to do some things in person, or if you have an online program, you may have like a virtual lab where you actually do a full visit simulation with different patients with different conditions on the computer, which is very interesting. I know we use Shadow Health. But anyways, when it comes to your notes, you'll find out that your chief complaint, your HPI, which is your history and physical, your review of systems, your actual diagnosis or diagnoses, and your plan. Those are going to be some major aspects in your notes. So make sure that before you start clinicals, you have solidified that, because I did have that assessment course, and I had, when I first started school, so I had that my first semester, and that was in fall of 2017. So mind you, I started full-time, switched to part-time once my second semester arrived, and so I'm just now having clinicals, but I had assessment way back in 2017. So anyways, though, just make sure that you solidify all those sections that you need to incorporate in your notes. Make sure that you solidify that knowledge on SOAP notes. SOAP notes is a thing. It's not BS, but SOAP notes is a thing. Your subjective, objective, your actual assessment, and then your plan. Make sure that you distinguish the difference between all of those, and just know what needs to be incorporated so that you can provide proper documentation and proper follow-ups when you do have a patient that you're seeing multiple times, because depending on where you work, you may have some frequent flyers who you see multiple times. But just solidify that knowledge before you start clinicals, because I would say, I had most of the gist down for things, but make sure that you know what to add. Also, how to describe things, because that was another thing that I don't want to say I struggle with, but I did have to look up things quite a bit when it came to, like, how do you describe, like the inner ear? How do you, these different terms? Like, how do you describe certain things? The sclera of the eye, the conjunctiva of the eye, and all that stuff. Anyways, just make sure that you, know how to adequately describe things before you start. Know what things look like as best that you can. YouTube videos, though, they're very helpful to kind of gain some grasp of that as well. And then, of course, your textbooks and reading that stuff. But, just try to solidify a lot of those things and skills before you go to clinical, so that you can try to get as much as you can out of the clinical. But yeah, by this time, I would say I feel a lot more comfortable than I did starting out. Now I feel like I can adequately focus in on what a patient needs to get checked. So, as an example, if somebody comes in and they have like a cough, you know, then you need to know what type of things you need to ask them. You know, like, okay, well, what kind of cough is this? Is it waking you up at night? Do you smoke? How do their lungs sound? You may want to look at the eyes, the ears, nose, throat, because all those things are connected. You might want to look at skin color, you know, see if they may be more pale or cyanotic anywhere. There's just a lot of different things that you want to look at, a lot of history that you want to get, because a person may have some new onset asthma, they might have COPD. We saw a lot of that in my facility that I did clinicals at. So yeah, just make sure that you know how to focus in your assessments on what now do you think that you're going to be looking for a diagnosis to be, once they say that they have a cough, or once they say that they have some abdominal pain. And then also, you know, you will learn to when you need to refer somebody, when they need to maybe get some imaging studies done before you can actually do anything else, or when you just kind of want to monitor somebody, you know, and they may not need a referral either. You know, they may just not require it. They might be a diabetic, but they may not need, you know, a foot exam right now. Or they may have some GI troubles, but it may not really warrant the insurance to cover a colonoscopy. So there's just so many different things, and I could ramble on and on and on, but I would say that the more that you read and you know your guidelines and how to form your notes and what to include and what to ask and what to focus on, that will really help you in your first clinical experience. I can't speak on any future ones like women's health or peds, and my upcoming clinical will be urgent care. So I'm hoping to gain some more experience there. But overall, I can definitely say though that I did have a good starter clinical, you know, to kind of give me a chance to breathe and all that good stuff. On another note, there has been quite a few updates. So last time I talked to you guys, I think I mentioned like I may have been in the process of applying to jobs or like looking for jobs or something, I don't know. But I did end up having 2 interviews, and I had one on the rehab floor, one was on a medical observation unit. Both were full-time. One was full-time days, and then one was full-time nights. So to fast forward till now, this is actually my last week at my current job. So Friday will be my official last day. I actually accepted a position at a hospital for a part-time nights rehab position. Luckily, the manager was very accommodating because it was originally a full-time position, and she did allow me to change that to part-time, because once I calculated everything out, it ended up actually pretty much working out financially to be about the same that I make now, just doing part-time nights for like the 2 12-hour shifts. So definitely I feel blessed in that aspect, that I'll have more free time to actually like think and just chill a little bit, but still study and get the most out of my schooling. Because I would say this, if you have a job that is very demanding, like with your time, even if it's not a physically demanding job, but if it's just demanding even on your time, because I was working 5 days out the week, and I have been doing that for like almost 3 years now. Once you start clinicals and then you got your lecture classes you got to worry about, it can be challenging, and I feel like sometimes you're so tired that you just are task oriented. But at this point, as providers or future providers, if you have a job that's like that and you can't fully put yourself into your schoolwork. And I know it's not doable for some people to do a schedule change, but I would say if you can, make sure that you do a position or you have a job that will allow you to focus more on school, because at the end of the day, you know, school is important, and you know, once you're a provider and stuff, that's going to be, you know, a little higher priority. You just want to make sure that you're prepared to the fullest and that you can fully get out of your program what you need to, because a lot of these programs, you know, they may not even be that great of a preparer, but your ability to put forth the effort for you to specifically learn the things that you need to learn is going to be really important, because you get out of everything what you put into it, and that's with anything. So yeah, I would definitely say that. So I'm glad that I'll be able to kind of do more focusing on what I need to focus on, because now I feel like I'm just very like on autopilot a lot of times. Yeah, and then even today I had a dentist appointment. Somehow I was thinking it was 6:30, but I knew in my head, like, wait a minute. So I got up to leave my house at like 5:50, and I said, wait, I think my appointment was actually at 6. In the calendar on my phone and everything, it say 6 o'clock. So I had to call and reschedule because I was gonna be like 20 or 30 minutes late. Yeah, so yeah, I'm just on autopilot, currently tired, but very glad that I'll be off all of next week to kind of give myself a little break, and just kind of get my mind together and get ready for a new change, and you know, get everything in order too at home, with just everything, cleaning, just, you know, reading things, studying stuff, getting some assignments done, because I do have a discussion post I need to finish up probably today. And then I have a quiz on diabetes today. Well, not today, but by the end of this week. And what else do I have to do? Oh, and then I have to respond to 2 other discussion posts after tomorrow. So I have to do those things, and get all that stuff done this week, and still try to have like a social life too, because otherwise I'll go crazy. But yeah, so that's what's new with me. Done with clinicals, new job. About 5 more weeks left of school. Yeah, 5 more weeks left of school. We'll be doing like a campus visit from April 30th to May the 2nd, where we'll be physically there doing some more hands-on skills. I know we have to do that Nexplanon and learn how to insert that. I think we'll be going over some billing and coding things, which is very highly needed. And I think all programs should go over that, because it is very complex. And I didn't realize how complex it was, but it's very complex. So we'll be doing a lot of that stuff for a few days there on campus. So that'll be kind of interesting. Not 100% looking forward to it, but it's needed. You know, it definitely is needed. But yeah, so 5 more weeks left of school for this semester, and then I'll be starting back early in May. Probably like the first week of May will be starting, either the first week, I want to say it's the first or the second week of May, one of the two. So I'll be starting pretty much right back up, going to clinicals at an urgent care for 2 days out the week now instead of the 1. So it'll just keep on moving, and I'll be done April of next year. So that is pretty much it.